My name is Kelli Pruitt, and today we're going to be discussing whether or not there should be a zero tolerance for workplace bullying. I want to start off by saying that bullying is not considered an acceptable behavior in any situation. However, having a zero tolerance for workplace bullying can both negatively and positively affect its environment. I chose this topic because bullying in the workplace, especially in the healthcare field and nursing, is an ongoing problem in today's society. I found this topic to be of concern for nursing based on how bullying is now acknowledged and how nursing is trying to control bullying today. Let's take a look at how the zero tolerance policy affects the nurse's role both negatively and positively, and by doing so, I'm going to give an example. A patient comes to the ER presenting with abdominal pain and requests pain medication. The nurse taking care of the patient does not meet the patient's demands right away, and the patient in turn yells, curses, and makes threatening comments towards the nurse. The nurse's facility at the time has a zero tolerance policy towards bullying in effect. So therefore, the nurse calls for outside personnel based on the policy, and the outside personnel ultimately restrain the patient and remove him from the nurse's care. A lot would agree that this is a positive effect of the policy because it does remove the nurse from a threatening situation where the patient was making the threatening comments. However, others disagree and feel that it's a negative impact because they feel that they're being de-skilled in their practice and that this can cause elimination of good nurse-to-patient relationship or rapport. Workplace bullying in nursing can occur with management, physicians, co-workers, and also patients and patients' families. Bullying is often described as acts by one in a higher level of authority, although it can be acts from co-workers, patients, or patients' families. This behavior can be verbal or nonverbal and can involve intentional actions to intimidate, degrade, humiliate, undermine, or create a risk to health and safety of the nurse. Bullying also threatens patient safety, which prompted the Joint Commission to include standards against bullying in the workplace. As I was doing my research, a phrase kept popping up in my head, and that is that nurses eat their young. And some of you may or may not have heard of this phrase before, but I wanted to go ahead and let you into what it means and so that you're better prepared whenever you do hear about it. It is a form of bullying behavior initiated by a more experienced nurse or co-worker. Although common, it's not okay. It's been used for over 30 years according to the Journal of Nursing Education and Practice 2017. New nurses may even find themselves involved in bullying in an attempt to fit in or to not be targets of bullying themselves. And it's very sad because I have seen a lot of this in my nursing career, especially whenever I was a newer nurse. I can't really say that it happened to me a whole lot, but there could have been some situations where I could have compared it to nurses eating their young for sure. But basically just don't fall into that trap. And if you see somebody that is being bullied, especially a newer nurse, take them under your wing and try to build up their confidence so that they can be a better nurse and provide the best patient care that they can. According to the American Nurse 2015, a recent American Nurses Association survey of 3,765 RNs found that half had been bullied in some manner. I want to talk about three effects or impacts that bullying in the workplace causes on an individual. Those can be things as physical effects, psychological effects, or even occupational effects. Some physical effects include but are limited to things such as hypertension, chest pain, heart palpitation, headaches, weight loss or gain, sleep disturbance, gastrointestinal upset, distress, and fatigue. It's very, very hard on you physically whenever you're being bullied. It's very hard. Psychological impacts with bullying can be things such as fear, anxiety, and a big one would be post-traumatic stress disorder or PTSD. Occupational impacts can include things such as absenteeism, because a lot of times if a nurse is bullied, she may tend to call in more than she was before she was bullied. You start to have poor relationships with your patients, managers, and coworkers. And then you may ultimately leave and find another job, or you may end up leaving the nursing profession altogether. A lot of research I did, a lot of people have completely gotten out of the healthcare field just based on being bullied, and it's very sad. Bullying can lead to a high turnover of staffing for an organization. In addition, the institution's reputation related to absenteeisms and decreased productivity related to the bullying could be costly to the organization. Nurses who are bullied inevitably experience emotional exhaustion and burnout, which often leads to decreased cognitive abilities to care for their patients. And oftentimes, patients are unknowingly victims to a weakened environment of care secondary to workplace bullying, which should never be the case. And workplace bullying in healthcare has been such an ongoing concern that in August of 2015, the ANA set a zero tolerance policy for workplace violence. This policy has been a positive one, but at the same time, it's also sparked controversy on its effectiveness. Zero tolerance for workplace bullying presents with many pros and cons to its policy. One pro, noted by those who support the policy, feel that the policy claims to minimize risks of bullying through policy adherence. The con to this theory is that others feel it reduces their role as nurses by eliminating their decisions about reacting to challenging behaviors, especially when it comes to their patients. Policy adherence to reduce risk of bullying seems like a good idea, but others may feel it's also good to be educated and prepared on how to handle these situations that can negatively affect your patient. Another pro to the policy is that with a zero tolerance, there's only one outcome to the behavior of bullying. However, only having one outcome provides less power in management when it comes to choice of disciplinary action. And for example, a facility's policy may state that if there's any bullying of any kind, then that employee will be terminated automatically. This in turn leaves management with little to no opportunity to educate or correct the employee's behavior. A zero tolerance also encourages employees to report incidences of bullying. Many would agree that this is acceptable, but others may disagree by saying that these reports are causing wrongful termination. And I'm going to give an example. A lot of times nurses will use constructive criticism to help a coworker become a better nurse, and that nurse could get offended by the approach of the constructive criticism, and they can run to the management department and say, hey, I feel like I'm being bullied, and then what will happen is that other employee will be terminated, and really it would be a wrongful termination in that case because they were just trying to help out their coworker. But you do have to watch with constructive criticism because sometimes it can be interpreted as bullying, so you have to be very careful in how you word things and how you speak to people and your tone of voice. As you can tell, the zero tolerance policy has its good and its bad points. There's really no evidence at this time that I could find in my research that claims the policy has been effective for eliminating bullying in the workplace. But this is why, as nurses, we need to be taking action to help eliminate bullying in our work environments. A big thing would be education. That should be our first approach, followed by learning signs of an escalating situation and how to intervene. It's also important to know who and what your resources are, and it's important to maintain a positive attitude and don't remain silent if you feel that you or someone else is being bullied. I'm highly impressed that the ANA is making such an effort to eliminate workplace bullying. Hopefully one day bullying will be a thing of the past and everybody can respect one another. The impact of bullying remains a serious concern not only on nurses' productivity, quality patient care delivery, and organizational financial loss, but also on the nurse victim's physical and psychological conditions. It is imperative nurses, nurse leaders, administrators, and healthcare policymakers develop strategies to transform the healthcare environment into a physically and psychologically safe workplace. There's one other thing I want to mention, and that's the American Nurse, October 2015, to prevent bullying. The ANA recommends that RNs commit to promoting healthy interpersonal relationships and include actions taken and not taken. Among recommendations for employees are provide a mechanism for RNs to seek support when feeling threatened, inform employees about available strategies for conflict resolution and respectful communication, and offer education sessions on bullying, including prevention strategies. The ANA has several resources to help RNs address and prevent bullying in the workplace, including the booklet Bullying in the Workplace and Reversing a Culture and a bullying tip card. Thank you.